Hi, everyone. Thank you so much for joining our COVID-19 Delta variant training. And let's go ahead and jump in. What is the Delta variant? So first we got to talk about COVID-19. COVID-19 has a high mutation rate, and a key term here is going to be genomic signal, which means a unique genetic characteristics or information encoded in the DNA or the RNA of the organism. And so what this means is that the population is going to continue to see an evolution of the virus because of that. The CDC monitors genomic signals. The Delta variant was identified first in India, and on June 15th, 2021, that's when it was considered a concern to the CDC. The Delta variant is twice as transmissible as the original COVID strain. How is it transmitted? It's primarily going to be transmitted through respiratory droplets. When an infected person breathes, coughs, or sneezes, this is why we're continuing to promote the use of masks. Some symptoms here are going to be sore throat, runny nose, head congestion, fever. A lot of these are similar to the general COVID-19 strain. However, some experts and people in general are noticing that it's hard to decipher between a common cold or allergies. However, it should be taken just as seriously as the original COVID and not just like a cold or allergies. Another thing to note is that a loss of smell and taste is not as common with this strain. The infectious window here, most people are infectious between 2 to 3 days after symptoms start. The latent period, referring to the time from exposure to the virus detection, is 4 days for Delta, with a range of 3 to 5 days. When compared to the original COVID strain, it takes about 6 days with a range of 5 to 8. So that makes it 2 days faster than the original strain. The risk factors is going to be similar to the original COVID strain. It's going to be unvaccinated people, and that refers to folks who are don't want to take the vaccine, folks who haven't completed the series yet, depending on which vaccine they chose to get, or if they haven't got their booster. So we want to be fully vaccinated. Close contact with infected individuals, environmental factors like indoor, poorly ventilated spaces, demographics, and socioeconomic factors. Who is susceptible? Unvaccinated individuals will be susceptible, older adults, especially over the age of 65, people with underlying health conditions like heart disease, diabetes, obesity, and respiratory conditions. People in the clinic that will be exposed is going to be everyone listed above, as well as healthcare workers who work directly with COVID-19 Delta variant patients. How are we going to continue to protect staff? We're going to do the same protocols we've been doing for COVID-19. We're going to continue to encourage folks to get vaccinated, wearing PPE, so whether that's goggles, masks, shields, gloves, gowns, all that, and washing hands and practicing hygienic practices. Where to test, we can go anywhere like we would normally test for COVID. However, there's not going to be a way to identify the actual Delta variant for a general population. The variant identification requires genomic sequencing, which only specific labs do. So regular COVID tests will not detect variants. So why is Delta variant important? It's important because it's a high transmission rate, meaning the Delta variant is going to spread more easily than previous strains. It's the increased number of Delta cases can continue to overwhelm healthcare facilities, and controlling the spread is going to be important for protecting vulnerable populations, especially for those who are not able to take the vaccine. And to close up, other considerations is we're going to continue to educate ourselves, each other, and the public. The more we find out, the more we'll be able to hand out information to you. We're going to advocate for mental health on the team, as we know that this is a bigger load for everyone, and we want to continue to support you. And we'll continue to follow policies through the local government and the CDC. Thank you. And here are references for you all. Have a great day.